Indication: DAYBUE is indicated for the treatment of Rett syndrome in adults and pediatric patients 2 years of age and older. Important safety information: warnings and precautions. Diarrhea. In a 12-week study and in long-term studies, 85% of patients treated with DAYBUE experienced diarrhea. In those treated with DAYBUE, 49% either had persistent diarrhea or recurrence after resolution despite dose interruptions, reductions, or concomitant anti-diarrheal therapy. Diarrhea severity was mild or moderate in 96% of cases. In the 12-week study, anti-diarrheal medication was used in 51% of patients treated with DAYBUE. Advise patients to stop laxatives before starting DAYBUE. If diarrhea occurs, patients should notify their healthcare provider, consider starting anti-diarrheal treatment, and monitor hydration status and increase oral fluids if needed. Interrupt, reduce dose, or discontinue DAYBUE if severe diarrhea occurs or if dehydration is suspected. Vomiting. In a 12-week study, vomiting occurred in 29% of patients treated with DAYBUE and in 12% of patients who received placebo. Patients with Rett syndrome are at risk for aspiration and aspiration pneumonia. Aspiration and aspiration pneumonia have been reported following vomiting in patients being treated with DAYBUE. Interrupt, reduce dose, or discontinue DAYBUE if vomiting is severe or occurs despite medical management. Weight loss. In the 12-week study, 12% of patients treated with DAYBUE experienced weight loss of greater than 7% from baseline, compared to 4% of patients who received placebo. In long-term studies, 2.2% of patients discontinued treatment with DAYBUE due to weight loss. Monitor weight and interrupt, reduce dose, or discontinue DAYBUE if significant weight loss occurs. Adverse reactions. The common adverse reactions, greater than or equal to 5% for DAYBUE-treated patients, and at least 2% greater than in placebo, reported in the 12-week study were diarrhea, 82% versus 20%, vomiting, 29% versus 12%, fever, 9% versus 4%, seizure, 9% versus 6%, anxiety, 8% versus 1%, decreased appetite, 8% versus 2%, fatigue, 8% versus 2%, and nasopharyngitis, 5% versus 1%. Drug interactions. Effect of DAYBUE on other drugs. DAYBUE is a weak CYP3A4 inhibitor. Therefore, plasma concentrations of CYP3A4 substrates may be increased if given concomitantly with DAYBUE. Closely monitor when DAYBUE is used in combination with orally administered CYP3A4 sensitive substrates, for which a small change in substrate plasma concentration may lead to serious toxicities. Plasma concentrations of OATP1B1 and OATP1B3 substrates may be increased if given concomitantly with DAYBUE. Avoid the concomitant use of DAYBUE with OATP1B1 and OATP1B3 substrates, for which a small change in substrate plasma concentration may lead to serious toxicities. Use in specific population. Renal impairment. DAYBUE is not recommended for patients with severe renal impairment. DAYBUE is available as an oral solution, 200 milligrams per milliliter. Please read the full prescribing information, also available at daybuehcp.com.